Hello friends, I'm Dr. Amit. We're doing a hair transplant today and we're going to be discussing various aspects of the planning and various aspects which a patient thinks of before committing themselves to a hair transplant. So we are blurring the face of our patient today because he's requested confidentiality. I'll also not be taking his name, and so we respect everybody's request on that, and we appreciate their request for confidentiality. So now you know we do a lot of hair transplants. We do various techniques. We do 6 different types of techniques, and so you would have seen some of our results on Instagram or Facebook and on YouTube, and honestly you know those results are exceptional. But the idea is not, as you know, the idea in these videos is not to talk about the results. The idea in these videos is to talk about the patient, is to talk about what a patient wants and what a patient thinks like. So I'm going to be asking our patient today about the factors which are there on his mind, the factors which were there on his mind before he finally selected to do a transplant today. So आपको कब से hair fall की problem है रही? While you're seeing this video, just look to your lower left, you will see the subscription icon. Just press that to subscribe to my channel. As soon as you press that, you will see a bell icon. Click that, it's on your lower left, and that will tell you about my subsequent videos. On the right side, lower below, just below the screen, you will see the like button. Please like these videos. On the top is the scroll of the subsequent videos, and at the end of this video, you will see 4 videos which will show you the next coming videos. Yeah.
Last 2 years.
2 years. So पहले hair was more or less normal.
Yes.
And in these 2 years, had you met doctors regarding hair fall treatment?
Yes, I have met 3 doctors.
Okay.
Last year.
Okay.
And I have got 8 PRP sessions.
8 PRP sessions.
Yes.
And PRP did not stop hair fall.
PRP did not stop hair fall, but for a few days or weeks, you can say that there is no hair fall.
So friends, you must know that PRP is not a treatment to stop hair fall. It can at best stabilize hair fall. That is what I always tell all my patients, that PRP is not any magical drug, magical treatment, even though many doctors try to project it as some sort of a magic. It can at best reduce the rate of hair fall or stabilize hair fall for a few weeks. Now, आपको ये कंडीशन, जैसे इतना हेयर फॉल है, अब तो बॉल्डनेस की स्टेज तक आ गए, ये भी काफी साल 1.5 साल उससे ज्यादा ही हो गया होगा ऑलमोस्ट. सो इतने दिनों में कभी हेयर ट्रांसप्लांट की नहीं सोची?
नहीं, इतने टाइम में मैं सर्च कर रहा था एक अच्छे डॉक्टर को.
सर्च कर रहे थे, तो उस सर्च में, डॉक्टर्स का नाम नहीं पूछ रहा हूँ, बट उस सर्च जब आप कर रहे थे तो मेंटली एक चेकलिस्ट होती है कि मैं ये चीजें मुझे चाहिए.
Yes.
ये चीजें जब तक टिक नहीं होंगी, मैं कॉन्फिडेंस नहीं मिलेगा. क्या थी
वो चीजें? फर्स्ट ऑफ ऑल तो ये होता है मेंटल सेटिस्फेक्शन, कि पहले आप ट्रस्ट करें किसी भी डॉक्टर को कि वो आपको टच करेगा, आपको ऑपरेट करेगा, तो आप सेफ हैंड्स में हैं. फर्स्ट थिंग ये. सेकंड ये होता है कि एक्सपीरियंस कितना है डॉक्टर को, क्या वो ठीक से आपका ट्रीटमेंट कर पाएंगे या नहीं कर पाएंगे. और थर्ड ये होता है कि रिजल्ट आपको पॉजिटिव मिल रहे हैं या नेगेटिव मिल रहे हैं, ये डिपेंड करता है.
So, जो आपने पहली बात करी कॉन्फिडेंस की, तो वो कॉन्फिडेंस कैसे बनेगा?
कॉन्फिडेंस ये डिपेंड करता है कि एक पर्सन सेकंड पर्सन को कितना फेथ कर रहा है. चाहे वो आपकी यूट्यूब से वीडियो देखें या इंस्टाग्राम से फॉलो करें, तो फिर एक चार्म होता है किसी भी इंसान का, किसी भी पर्सन को कन्विंस करने का. तो वो डिपेंड करता है कि आप कहाँ से ऑपरेट करा रहे हो.
चलिए मैं आपको एक सिचुएशन देता हूँ. मैंने एक 5 स्टार होटल जैसा एंट्री बना दी, लाउंज बना दिया, और बिल्कुल टाई पहन के एक आपके सामने एक डेंटल सर्जन को रख दिया, एप्रन बना के, टाई वाई बिल्कुल सूटेड बूटेड. इम्प्रेस तो हो ही गए.
Yes.
करा लेंगे ट्रांसप्लांट?
नो.
आपने तो पूछा ही नहीं ना डॉक्टर है कि नहीं.
That's what I'm saying that हर प्रोसीजर जो है वो एक परफेक्शन जो जिस चीज़ के लिए बनाया गया है उसी से कराना चाहिए.
सो इम्पोर्टेंट चीज़ जो मेरे हिसाब से आपका सबसे पहला सवाल होना चाहिए, whoever you're searching for, please check their degrees. Please make sure that that person is qualified enough to do that procedure. So it is essential. अगर आप दांत निकलवा रहे हैं तो मेरे पास मत आइए, और अगर हेयर ट्रांसप्लांट करा रहे हैं तो किसी डेंटिस्ट के पास मत जाइए. So if you don't trust me to take out your tooth, how can you trust a dentist to do your hair transplant? It's a very important question that you must think of. As a patient, make sure you start asking questions. Start asking questions that government has given you an MD degree of medicine or dermatology. Where has the government said that you can do surgery? Please show that document where an MD holding person can do surgery. Please start asking that if you are a homeopath physician, why has the government of India not given you permission to do hair transplant and not registered you under Delhi Medical Council, which allows you to practice allopathic medicine in Delhi and in India? So if you are a homeopath physician and you are doing hair transplant, is it legal or illegal? So please, as a patient, start asking questions and start raising awareness amongst yourselves and amongst your friends. Now, there are a lot of clinics. The only reason they run is because of your ignorance, because you don't ask, and it is my mission to make you aware of this fact. So please respect the speciality of doctors. For plastic surgeons, it takes us more than 15 years of studies to become a plastic surgeon and then to specialize in what we do. A homeopath physician in 3 years can start doing hair transplants. It's most unfair on you, not on us. Now, there are ample number of patients who can trust us to do their transplants, but we want that every patient should get the specialized treatment. So that's one of the most important things you should ask for, is the degree, qualification and results of a doctor. So we'll move ahead. That is the one point which I always try to project. Second point I always try to project is, remember, FUE, the extraction technique, is not better than FUT. It is no way better, or is it not, no way it is magical. Many respects, FUT strip is far better than FUE. Today 90% of clinics do FUE. Please understand the reasons for it. क्यों करते हैं 90% से ज़्यादा clinics FUE? क्योंकि technicians rent पे मिल जाते हैं. It's very easy to get technicians on rent in Delhi. Pay them X amount of money and get the transplant done. It is much cheaper to do FUE. Get 2 people to do FUE, it's done. To do a strip, you need more than 10 or 11 people to get the perfect result. It is more cost intensive, and then you need a plastic surgeon. FUE can be done by almost anyone on earth, and for doing a proper strip procedure, you need to have a plastic surgeon, without which you will have a lot of problems. So that is why 90% of clinics do it, and when you check those 90% of clinics, at least more than 90% of those 90% clinics don't have a registration certificate to do hair transplant in India. So take up that challenge and find out for yourself. So we're going to move on. We're going to talk of the planning, and I'm just in the next few minutes I'm just going to do the marking and understand how the planning is done.